We've arrived at an industry now that I'm really excited about where we can finally make use of the data that's collected from imaging, from pathology, from lab results, and then make those resources available to patients and physicians. Nashville, as a leader in the business of healthcare for now 6 decades, has a critical role to play in how this industry shapes the future of care delivery.
That's great. And John, you and I are not healthcare people day to day, but where do you see the opportunity for Nashville in digital health after spending a few years assessing what's happening in that industry?
And I'm gonna start at the end and then work my way back, because now it all started to make sense after met Eric several years ago. In conversations that we had, he was talking about how where care was heading, this more personalized care, it's precision. So it's not this treats most people, but now it's directly to you that you can then access from or deliver from anywhere in the world. And I started thinking about that to say, yeah, that makes sense now why maybe I was thinking, say, 10 years ago, that you could see challenges within the healthcare industry. And those challenges that used to be very local now were very global, meaning the same thing that was affecting care in Japan, the UK, Canada, the US, they were all the same. And so these solutions, and cost was going up, right? As aging population and what have you. And so these solutions then really are what's going to allow us to take care of the ever growing population that we have in a way that where most people can get access to good quality healthcare. And so from my perspective, if you look around, I see the major deliverers of care in the United States right here, headquartered right here. So, where it's home health, behavioral health, acute care hospitals, ambulatory surgery centers, and I'm sure there are others, that this is, if we're going to do this, if we're going to make real change, it probably has to occur at that enterprise level. And that then we can drive that out and then connecting that to the world. Because again, all of this innovation that Eric has always talked about, a lot of it is occurring here. And then a lot of it is also occurring, say, in the UK, in Canada, and other places. We can connect all those ecosystems back to Nashville, where a lot of these decisions then for what is healthcare in the United States are being made.